Mycobacteria. So there are a few things here that we need to appreciate, particularly in terms of the pharmacology. And before I start with the pharmacology itself entirely, we're going to appreciate the four drugs that are rifampicin, isoniazid, pyrazinamide, and ethambutol. Now there is an easier way to learn these, and I'm going to go into that. But just before we go there, Mycobacteria, there are three types, generally speaking: Mycobacterium tuberculosis, Mycobacterium bovis, and Mycobacterium africanum. Now, Mycobacterium tuberculosis is actually what we call an acid-fast bacillus. Acid-fast. It's a bacillus, hence the shape you'll appreciate as per the microbiology, and it stains red on nasal Nielsen staining. Bovis refers to cow, so this is the cow form, and then we've got the last africanum, which is quite a rare form. The mycobacterium itself has 4 layers. We have the cell membrane at the bottom, and then we have actual 3 layers to the walls, and these 3 layers can be remembered as MAP. Okay, MAP, going from superficial to deep. The layers are important. Why? Because these 4 medications work on various areas of this. The most important one I'm going to throw here, difficult to remember the layers, and so it's easier sometimes just to appreciate the middle layer. For me, the middle layer is the Arab layer, and the Arab layer essentially for me is a memory word of M for middle, as in the middle layer, and my respected colleagues, the Arabs from the Middle East. And that's how I will remember my middle layer with the Arabs. The East is important here because my ethambutol is what works over here. So my middle layer, Arabs from the Middle East, my ethambutol works on this side. My isoniazid essentially is what works up here. Let's change that to red. So isoniazid is what's going to work here, and my ethambutol over here. And that's really those guys. One could appreciate that these are your vowels in the English alphabet, and that's how you remember those. Moving on, the 4 drugs that are, we can remember it using the mnemonic RIPE, RIPE, in that order, and there's some benefit to that. The benefit being that the first 2 drugs you're going to use are essentially for 4 months, and all 4 drugs that you're going to use for 2 months. Okay, so 2 for 4, 4 for 2. All 4 we're going to administer for month number 1 and 2, and the first 2 we're going to have for an additional month 3, 4, 5, and 6. Therefore making the treatment a whole duration of 6 months. Now appreciate, this is not definitive. This may go on 6 to 9 months. Generally, in practice, it's 9 months. It was pyrazinamide that actually brought down the duration of treatment from 12 months all the way down to what is now deemed as generally being 6 months. The other thing we want to appreciate is the actual enzymes on which these drugs work. 2 of the drugs, that's your middle 2, work on 2 enzymes, and they are called Faz. Okay, my good friend Faz. And if there's a phasal here, happy days, this one is out to you. There's 2 and 1, so Faz 2 and Faz 1. Now appreciate pyrazinamide is perhaps not so much Faz 1 anymore, rather it's S1, and that's still good enough for me for my mnemonic to give me Faz 1. So RIPE, the middle 2, Faz 2 and Faz 1. Okay, one of the most important things I wanted to appreciate is the actual side effects to these medications, and there is a great mnemonic. Now this is not one I made, rather it's borrowed from somebody else. I couldn't remember who for the life of me, and so hats off to the individual who actually created this mnemonic. But these are essentially what I'm bringing here, these side effects. So rifampicin will give you discolored urine, isoniazid will give you peripheral neuropathy, pyrazinamide will give you hepatotoxicity, and ethambutol will give you optic neuritis. The what I was going to point out is we can actually call this rifampicin. So you can actually call this rifampicin. Okay. And in doing so, you've got the discolored urine. What is a discoloration? It's urine. It's orange. This urine is, and it's like your drink Lucozade. So that's why I'm drawing it in orange. Next in line, you've got isoniazid, and here we will call this isonerve acid. Okay, we'll call this one isonerve acid. And isonerve acid, because your nerve, essentially, we're going to have peripheral neuropathy. We then have pyra, and then instead of calling it zinamide, we're going to call it levamide. So we have pyrrolivamide, and levamide being hepatotoxicity. And finally, we have ethambutol, and instead of calling it ethambutol, we'll call it ithambutol because it gives us optic neuritis appreciating this cranial nerve number 2. And cranial nerve number 2, if you recall from the cranial nerve lecture, is sensory in nature. And there you have it. Thank you for watching.